The broadcast is now starting. All attendees are in listen-only mode.
Good morning for everyone just joining us. We're going to give it a minute or so here, as we would do with any webinar or Zoom meeting, to let people trickle in, and then we'll kind of get started. So if you're hanging out on your computer watching us do nothing, that's the reason. Well, I think we'll go ahead and get started. First of all, welcome to everyone who's joining us. My name is Rob Bryan. I'm a local oral and maxillofacial surgeon with Oral Surgery Specialists of Oklahoma. And as some of you who have been with us in the past know, we get real excited about this event. This is our Academic Advantage program. And over the years, one of the things that we've realized is we can be an asset to people that are looking to get into medical school or dental school or any other type of professional program. And the purpose here is to give a little bit of insight into the day-to-day goings-on of a practice. What are some little tips and tricks that would be helpful for someone who's looking to become a physician or become a surgeon or another type of healthcare professional, maybe a nurse practitioner. And that's the great thing about how we stage this. We try to have a variety of people available to speak every year. And so you'll notice this year, I'm not going to give it away quite yet, but we have a new addition to not only our team, but also the panel here on Academic Advantage, which is super exciting. And the world of healthcare is vast, and it encompasses so many different types of practitioners, so many types of specialists, so many types of assistants and technicians that this program could go on and on and on all day long, talking about the scope of practice of healthcare. And so we're super excited that all of you are here to join us. It is an honor and a privilege for us to do the things that we do every day. And it's just really humbling that people would join us on a Saturday to learn more about what we do. And we're super excited that you're here with us, and look forward to answering some of the questions that you posed to us ahead of time. So we'll proceed on here to start the program. So this is the agenda for today. Some of the speakers that we have Dr. Jeremy Phelps, who's been with us in the past, very, very talented, very, very knowledgeable neurosurgeon at Integris Medical Group. Then there's myself, who I've already introduced, my partners, Dr. Jeremy Goodson and Dr. Hayden Fuller, who's new with us. She is a periodontist, a specialist in dentistry. We've not had a periodontist in the past, so I look forward to hearing the things that she's going to be sharing with you today regarding her specialty and the things that she did to get to the point where she is. And then we also have a very special guest here again this year, Stephanie Chaplin, who is a counselor at Putnam City Schools. Very charismatic individual who we met last year, and we are thrilled to have her back again with us. And she's going to have great information for you regarding some of the things that we're not expert at answering those questions. So we look forward to her insight as well. And we'll go to the next slide, please. Well, this is, again, myself. What a great picture. I was wearing makeup that day. I'm sorry I didn't have any on this morning for you. But again, I'm an oral and maxillofacial surgeon. I practice at Oral Surgery Specialists of Oklahoma. I've been doing that for the last 15 years, and it's been a really fun part of my life. I grew up in Ohio. I'm not from Oklahoma. Grew up in kind of an Appalachian area, I like to say. Super fun place to be. Lots of hills and creeks, and not many of those here where we live in Oklahoma City, but there are a lot of other great things about Oklahoma. Went to a very small high school called Fairland High School, home of the Dragons. Over the last year, I've spent time taking up a new hobby, and that is aviation. And you know, that's the great thing about kind of what we do and how we do it, is it does afford us the opportunity to play sometimes. And one of those things for me is flying, and it's very stimulating and has kind of acted as a way for me to get away. And you'll find that when you get into your career, no matter what it is, if it's in healthcare or if you decide to go in a different direction, one of the things that you're really going to want to do is have a hobby of some sort, because you will want time away from that career, even though you may love it and it provides a wonderful lifestyle for you. You do need time away, and so think about those things as you're kind of planning for your future. What are the things that I would want to do to keep me busy when I'm not doing the thing that's my career? As far as why I became an oral and maxillofacial surgeon, one of the things that I've always liked is science. I've liked math for a long time. Those are things that kind of came easy, for me. But I'm also kind of chatty, and I like people. I like talking to people, and sometimes when I start talking, I can't stop talking. And this really allows me to do kind of all three of those. It puts me behind in the office sometimes, because in addition to having people that you're operating on, you also have those same people that you're talking to and meeting and getting to know. And I think that's one of the things about our career that I didn't realize. I kind of thought that maybe being a surgeon would limit my ability to form kind of meaningful relationships with people, because you think about going to a surgeon, you don't think about going to them multiple times, maybe just one or two times, and then that's it. And sometimes that's the case, but we do have an opportunity to sit down and really form relationships with people that I think are meaningful. I love seeing people out in public that I've had as patients. One of the highlights is to be at a restaurant and have someone come up to you and say hello and show you their teeth while you're out in public. Like, oh, my tooth is still here. It's very gratifying to have that kind of thing happen. And we're blessed and fortunate to live and work in a state where people are known to be very, very nice and friendly. And so it only magnifies the enjoyment that I get out of doing the things that I love. And so I do live here in Oklahoma City, kind of on the northwest side, and I've been married to my wife, Allison, for 24 years, and have two lovely children who are pictured here in these photographs as well. And it's just been a joy and a privilege to be here and to do so many fun things and share my career with my family, but also with you guys. So my journey to get here started, of course, long before what you're seeing on the screen right now. I knew that I wanted to be, I think I decided I wanted to be a dentist in about the 9th grade, maybe the 10th. And after looking into it, I realized that in order to make that happen, there was some work that would need to be done ahead of time in the form of making sure that I have good grades. So that was part of sort of the prelude to what you're seeing here on the screen right now. From there, I went on to undergraduate school at Ohio University. Actually started out in a branch campus in Ironton, Ohio, which no one's ever heard of, and spent my first year taking kind of the prerequisite courses. The reason I did that is because I got a scholarship to there, and I wasn't going to turn that down. And I took most of my classes at nighttime, and during the daytime, I worked at a grocery store as a clerk in the customer service desk. And so you can do things like that. Now, you have to be careful because depending on which direction you want to go in your career, you have to make sure that there aren't things in your life that are jeopardizing the grades that you get in college, because literally every course that you take matters, and those grades are very, very important. I decided that I would do an emphasis in chemistry because that was something that really resonated with me. When I was a kid, I always had a chemistry set. I mean, there was never a time I can remember that I didn't have a chemistry set in my bedroom. And that was probably a dangerous thing. I don't recommend it. Probably a dangerous thing because, you know, chemistry sets do involve fire. Another one of my favorite things, just because it kind of keeps the chemical reaction running, depending on what kind of reaction it is. Sometimes that's not always true. But chemistry is something I really, really like and enjoy. It's just very intriguing. So I decided to put an emphasis on that. You could choose other topics, and we'll answer that question. Someone posed a question about that. We'll get more into that later. From there, I went on to The Ohio State University and went into dental school. And that's a 4-year program. And that's in Columbus, Ohio, which is a wonderful city. They're right in the middle of the state. And from there, went on to the University of Oklahoma Health Sciences Center here in Oklahoma City. And that's where I did my surgical residency. A residency program is one wherein you're already a doctor, but now you're honing your skills into a really particular sort of area of expertise. And I'm not sure where the word resident came from. I think it's probably because you spend most of your time there. And you actually are a resident, but of the hospital. Anyway, it was one of the greatest times in my life. Those 4 years that I spent as a resident were wonderful. Thoroughly enjoyed like 99% of that time spent. And I think the 1% that I didn't enjoy, I probably really did enjoy it. So it was a wonderful time, and that's kind of the journey that I took to get here. Next slide, please. And of course, this is my trusty partner, one of my trusty partners, Dr. Goodson. So I'll let him take over from here.
Good morning, everybody. It's so good to be with you. Dr. Bryan, thanks for introducing everyone, and it's good to hear about your early life. And I'll share a bit about mine as well. And I just want to extend a welcome to everyone again. You know, when I was looking over the people who had registered to join us this morning, it was neat to see that there was students on a variety of ages from all the way from 6th grade to 12th grade. And so I just commend you for taking some time on a Saturday. Things I wish I had been able to do when I was thinking about careers when I was younger is just have the chance to sit down and chat with some people who are in those careers. So, you know, I would try to visit with my doctor when I would have a doctor's appointment and maybe ask a couple questions. And what I've sort of discovered through life is that most people like to talk about the things that they love. And so it's actually a little easier than I had ever imagined to kind of corner someone and get them to tell you their story and give you some advice. So glad to be able to share with you all this morning. I'll tell you a little bit about me. I grew up in Missouri, or as some of us say it in Missouri, Missouri. I went to Blue Springs South High School, and I guess if I had to pick a favorite subject, I would pick math. Although I was tempted to list music on there because music is a passion for me, but I just couldn't quite bring myself to call music a subject, because it's so much more. And in fact, that's what I studied in college in addition to biochemistry. So I'll get to that in a second. But one of the reasons I ended up going into a medicine/dental profession is for the longest time, and perhaps some of you can relate to this, but I've just always felt really, really good giving to people in whatever capacity. And I remember doing that in certain healthcare settings, just with little service projects. There was one time I remember growing up where I was able to help do some chores, as you might call it, around a nursing home. And there was another time where I was able to do something like that at a hospital. And whenever I would get into those environments where there was somebody or many people who were in need, and in this case, physical illnesses, that sort of thing, it just felt really good to me to be able to serve those people. And I remember just feeling that good feeling at a young age, and I was almost like I was sort of feeling drawn to or called to that profession. And then as I got a little bit older, I thought more about this accident I'd had when I was 12 years old, where I had knocked a couple of my front teeth out, actually, or broken in half. And I still to this day credit my dentist back in Missouri, Dr. Betsy Ward, for having put me back together in a way that enabled me to continue playing the trumpet. I started playing the trumpet when I was about 6 years old, and it became a pretty big part of my life. So when I was 12, I was already 5 or 6 years into studying it, and keeping that going, made possible by my dentist, enabled me to play the trumpet for literally thousands and tens of thousands of people over the coming years. And it brought me so much joy. And so really, honestly, I look back and I feel like my dentist had a huge part in making that possible. So that's when I started realizing that some of these dental professions, which I had previously perceived as, a place to clean your teeth or, to help someone get out of pain, they can dramatically impact your life. And I have seen that to be true in ways just as meaningful as my personal experience for other people now as my patients. So we call home Edmond, Oklahoma. We've been here for 10 years now, and it's just been a great place to raise our family. My wife and I've got 4 wonderful kids. You can see pictured there. I love that little picture of my boys fighting with their lightsabers. And that was a day where we had their Batman pajamas and their Star Wars lightsabers, and they were playing a game that they liked to call Ninja Turtles. So we had a merger of 3 great imaginary worlds there. In my free time, my getaway for me that helps me recharge, reboot, and also exercise is biking. I love to bike, and that can be done road biking, and more lately the last few years I've been really enjoyed mountain biking. It's just a great thing for me. We can go to the next slide. I studied at a few different places. I actually did 1 year of undergraduate training at the University of Missouri. And I didn't list that on here because I graduated from Brigham Young University in Utah. That's where I did the remainder of my undergraduate studies. Following that, I went to the University of Iowa College of Dentistry. And that, of course, is in Iowa. Now, I hadn't really spent much time in Iowa and didn't really know how neat of a place Iowa was or how good it was for education. But I was so impressed with the Iowa Dental School, and still am very grateful for the training I received there. And as I went through dental school, funny story, I remember talking with my wife saying, when we get through all this together, hopefully I'll practice general dentistry. Because I love people and following through their life and their story. But if we choose to do a specialty, I'm definitely not going to do oral surgery. And there was just something about, I guess I was maybe a little bit uncomfortable with blood and surgical stuff. And I've noticed, as I've had people observe over the years, which we love having people shadow, I've noticed that it's a really common reaction for almost everybody to just feel a little funny when you see that stuff. But what I learned in dental school was that that's just kind of a reflex reaction, and you quickly get over that, and you're able to connect with people in a really meaningful way, and provide these procedures without any sort of weird feeling. In fact, you feel great about being able to transform somebody. So quickly felt kind of called to that profession and drawn to that, and so went down to the University of Oklahoma Health Sciences Center, as well as the University College of Dentistry for that surgical residency. So that's where I learned here in Oklahoma City to practice oral and maxillofacial surgery. And it's been a wonderful profession these past 5 or 6 years. So we'll let Dr. Hayden Fuller, our other partner, go ahead and take a few minutes to introduce herself.
Hey guys, I'm Hayden Fuller, and I work with these two. I work with Dr. Bryan and Dr. Goodson. They brought me on in August, and it's been awesome to work there with them. I'm actually a slightly different specialty than an oral surgeon. I'm a periodontist. As you can see on the slide here, it says periodontist. And we'll go in a little bit more to detail of what exactly is different about that. There's probably a little more similarities than there are differences, but there is a distinction there between the two. And it's really cool because it's allowed our practice to provide kind of both types of services to people. And it's a model that's not really done a whole lot in the state of Oklahoma. Other states have done it, but we've really, really enjoyed it. It's been great. So let's go to the next slide. So I grew up right here in Oklahoma City, and I went to Heritage Hall for all my school from age 3 to senior year of high school. And my favorite subject, I think it's hard to pick a favorite. I just always really liked school. And I think science was probably my favorite, but I also kind of like Dr. Goodson. I had this other side that I really liked art a lot. I loved art class. I loved painting. I grew up doing lots of arts and crafts with my family. And it as much as science is like this big part of me, that's almost like not a favorite subject. It's just kind of part of who I am. And so I love science, but I also love the arts. And so periodontics is what a lot of people would refer to as like a gum surgeon. And the word periodontics means peri means around and dont means tooth. So we basically are the surgical specialty that concerns with the tissues around the tooth, which is the gums and the bone. And so like if someone has gum or bone disease, we treat that. If someone has or needs a tooth taken out and an implant put in, that also concerns the bone and soft tissue and making sure everything is functional and also looks great and is aesthetic. So what's really neat about periodontics, and I would say also true about dentistry, is that it does combine kind of that artistic side of things along with science. So, you know, you're learning about biology and anatomy in order to be a dentist or a dental specialist. But also in a lot of dentistry, there is an artistic aspect. And that's why I included this picture here of this crown that is actually a temporary crown that someone would wear on top of their new dental implant until they were ready to have their final crown. And I just think it's so fun to make things shiny and pretty and match their other teeth. And it's something that has been a really cool side of dentistry, to also have that artistic aspect in every day. And surgery is an art as well. You know, I think Dr. Bryan and Dr. Goodson would probably agree with that. You know, every time you're making an incision, you've got to think about kind of where you're going to make the incision and what that's going to look like when it heals. And How am I going to design this? And it really is, there is this aspect of art, which you might not think when you first think about surgery, but it really is. If you find yourself kind of an artistic person, it really can be fulfilling if you've got kind of that passion. And then let's see, I said that it included a social aspect, which they've already touched on as well. And it's something that you can be this doctor, but you're also interacting with people, and people, when they come in, they're very fearful and they really give a lot to you. They unload a lot on you. You know, they're worried about their smile, which is something that's very, you know, intimate to a person, and it's their face and it's how they interact with the world. But then a lot of people are afraid of surgery, and especially of the dentist or the to have dental surgery. And so you do have this part of your job, a huge part of your job, that is getting to know these people and to put them at ease. And I think that that is something that, if you're, you know, I'm an introvert, but I still do love to interact with people, like kind of on a one-on-one level. And it's something that's really kind of fed my soul in this job. So along with that, surgery, as Dr. Goodson mentioned, started out for me also as kind of a scary thought. I never really liked blood when I was growing up. In fact, when I got my ears pierced, I fainted in the store. I went to Claire's at the mall and I got my ears pierced and I just fainted. And then anytime I had a tooth that came out when I was growing up, I would faint at that, just with a little dot of blood in my mouth. But funny enough, you do really get used to it. It's something that if you kind of, once you learn about how you really are caring for these people, and the surgery that you're doing is going to make them better, you really stop seeing it as something weird and gross. You see it as something wonderful. And so I would totally agree with that. I wouldn't shy away from a health, you know, career profession or surgery just because you think blood is kind of scary, because I was right there with you, if that's how you are. Surgery is fun, and dentistry, dental surgery, is a way to do surgery with good hours. And we can talk about that more later in detail, but that is something that you don't always see in the medical profession. And again, like I said, my home is Oklahoma City, and a fun fact about me, my family lives here. They're all here. I'm so lucky. And I got married in January. And it's just been such a blessing to be able to work in the city that my whole family lives in. I know not everyone's situation is like that, but I've been very lucky that everybody is here, and because that's something that's very important to me too, is balancing that family life as well. Let's go to the next slide. So I went to college at TCU in Fort Worth, Texas, and I got, my major was in biology. I got a chemistry minor with that, and Dr. Bryan was talking a bit about this. You know, you take you have to take these core classes, but you can kind of pick which one you want to focus on. And obviously, if your major is something totally different, like history or something, that you're also taking these core science prereqs to get into medical school or dental school. And so I ended up, since I liked science, I just picked biology for my major, and it was something that I really did enjoy. And I ended up taking enough chemistry classes along with that I just ended up getting a minor. I didn't go to college thinking this is what I'm going to do. It's just you kind of start taking classes. And in fact, I think I even declared a chemistry major at first and ended up swapping to biology. So it's something that is fluid and you can change as you're in it. And then I went to OU here in Oklahoma City at the Health Science Center for dental school. And again, that was a 4-year program, and graduated with my Doctor of Dental Surgery, my DDS. And then graduated from residency also at the same campus at OU with a master's in periodontics. And this is a little bit different than the oral surgery residency. It's not hospital based. You're in a clinic, you are doing surgery, but you are in the dental school seeing patients there, not in the hospital. And you're taking a lot of classes, and you also do a master's thesis to get a master's degree. So it's a little bit different in that, and also that since you're getting a degree, you do have to pay tuition. And so unlike, you know, a residency like oral surgery where you're at the hospital and you're getting paid a little bit, a master's of science residency, you actually do pay tuition. So there's a lot of different residencies out there, and there's a lot of different degrees and different ways of going about things. And I'll make a point here that when I set out to TCU in Fort Worth, I did not even know what a periodontist was. And so, you know, your journey will kind of take you different directions, but I think it's just important to kind of think, what do I like? What am I good at? Maybe I switch my major. Maybe that means I go to dental school instead of medical school like I thought. And now that I'm in dental school, you know, maybe I think I want to be an orthodontist, but maybe by the end of it, you choose surgery instead, you know, so just keep an open mind. That's kind of how it was for me. And we can go to the next slide.
So one of the reasons we like to show a video like that is it really, in many ways, exemplifies why we love it so much. You know, the people that we meet, and to hear how what we do has an effect on their life is pretty incredible. And every time I watch that, it just kind of gives me chills. It's just wonderful to see the fruits of your labor, I guess, in many ways. And that's one of the great things about healthcare is you will see the fruits of your labor. And there will be times when, as a healthcare provider, that you will feel different emotions. Sometimes you'll feel sorrow because not every outcome is a great outcome. But the good thing is the vast majority of what we do turns out really, really great. We've talked a little bit about us as being oral and maxillofacial surgeons, and you've seen up to this point that to get here we went to dental school. So oral and maxillofacial surgery, periodontics, orthodontics, endodontics, there are a variety of dental specialties. All of those are rooted, pun intended, in dentistry. And so there are the vast majority of people that go to dental school will graduate from that program and start practicing general dentistry. That's what most people will do. And there are some differences in that. General dentistry provides a variety of topics that you could become interested in. The more specialized you become in any area of healthcare, the less broad and more narrow the spectrum of your practice becomes. So that's something to keep in mind when you're thinking about becoming a healthcare provider, is to what extent do I want latitude or options or choices in the things that I do from day to day. That's the biggest difference between a general dentist and any other dental specialist, oral and maxillofacial surgeon or periodontist. A lot of our general dental colleagues do some of the things that we do, and it's okay for them to do that, but then a large number of them focus more on things that are specifically related to the tooth itself, such as crowns and bridges, aesthetic type work. That's where a lot of the artistry of dentistry comes into play. And I would love to, and perhaps we'll do this coming up in the coming years, have one of our general dental colleagues to show you some of the incredible work that they do that's just beautiful and, frankly speaking, life-changing. There, as mentioned here, there is a little bit of a difference in the time that you spend in school. You'll see at the top there. Typically, to become a general dentist, you could spend about 8 years in college. And if you do sort of everything consecutively and you don't really take any time off, that's how long it would take you to become a general dentist. There are dental schools all over the country. We have one here in Oklahoma. I'm pretty sure about every state in the country has at least one dental school. Some of them have multiple dental schools. My home state of Ohio has a few. But as you'll notice there, the specialty programs do carry with them additional time spent in training. Some people would look at that as a downside, but we have, I'm sure Dr. Goodson and Dr. Fuller would agree, my specialty training was just wonderful, and we thoroughly enjoy that. As an oral surgeon or a periodontist, you will be doing more involved types of surgical procedures. Dr. Goodson and I do a lot of facial reconstruction. We also take care of patients that have been in car accidents, have been in other types of traumatic events where they've received extensive damage to their face, and we have an opportunity to go in and repair those injuries for them. Let's go to the next slide, please. So what exactly, we've talked a lot about, kind of how do you become an oral surgeon, how do you become a dentist, but what exactly is it like for me every day? So typically I work Monday through Friday. That's the majority of my time spent working occurs during the weekdays. I choose to start at around 8:30. You could start earlier. Some of my colleagues start at 7. 8:30 is about as late as probably most people would start their day. And most of the time, when I get to the office, I'll have a couple of surgeries to do in the morning time. Most of our surgical procedures are performed during the morning hours because the patients are supposed to come to the office having had nothing to eat or drink. So it's hard to keep them waiting for an afternoon appointment to do a surgery. So most of my mornings, Monday through Friday, are spent doing surgeries. And then in the afternoon, we'll do consultations and post-operative visits. So a consultation is a visit where, if you have some sort of an issue that you'd like to have looked at, you'd phone our office and get scheduled for a consultation. And during that visit, you just come in and we sit down and talk about it. So some of the pictures that you'll see here on the bottom half of the screen there, the x-ray that's on the monitor there, the young lady sitting in the chair, those are consultation visits where we're looking at an x-ray, we're doing a clinical exam, and sometimes we take measurements, sometimes we take photographs, almost always we take some sort of x-ray, and then that will allow us to kind of plan for the surgery. I do take call, and Dr. Goodson will speak about this as well, at local hospitals. So there are some times that I'll be working outside of the scope of Monday through Friday. Sometimes it's in the nighttime. Sometimes it's in the middle of the night. and sometimes it's on the weekend. And during those week periods of time when I'm week meaning 7 days period of time when I'm on call, you could get a phone call from a hospital really anytime, any day, for just a variety of reasons when a patient has some sort of a problem that needs to be addressed in a more urgent fashion. And then I usually try to wrap up my day and be back at my house by 6 o'clock. Sometimes I'm a little later than that. Sometimes I'm earlier. The great thing about that is, since I do have 2 small children, the Monday through Friday kind of 9-ish to 5-ish sort of work schedule allows me to take part in a lot of their extracurricular activities and go to their baseball games and things like that. And since I typically don't work on the weekends, I can go to a lot of those soccer games and stuff that my kids are involved with. Go to the next slide, please. So a lot of what we do is done in the office, like I mentioned. And one of the main things that we spend time doing is taking out wisdom teeth. And you'll see here a cool little x-ray. So when I started in my practice several years ago, we didn't have these fancy x-rays like you see here. We had them available in the hospital, but we really didn't have them available in our office. And so, this is a cool image that allows us to see a lot of details. And so you'll notice this individual that we're looking at here, there's a little purple or pink, whichever one, magenta line that you see there. That represents a nerve. And so a lot of the things that we do in the office will need imaging studies like this, taking out wisdom teeth being one of them. So this is one of the more common procedures that you would do as an oral and maxillofacial surgeon. You can see in this, now see I'm starting to do a consult automatically here with you guys. You can see in this image the teeth that are in the very, very back there. Those are wisdom teeth. And you'll also notice there's a tooth lurking up by the eye socket there on one of those images. And so that's one of the reasons we take wisdom teeth out, is because left in place, they can start doing things that we don't want them to do and really cause some problems. Go to the next slide, please. Let's see here, Dr. Goodson, was I going to do this one or?
Nope, I'm up here. So we'll just kind of tell you about some of the procedures we do here in the office. You're seeing an animation right now of what's called a dental implant. And essentially, this is a way to replace teeth. For many, many years, I mean, you can even look back historically in museums, where centuries ago there was these inventions of how to get teeth back in the mouth. From anything from wiring things in there to wooden teeth, hundreds of years ago, up to more recent years where people would use something called a bridge, where it's you use neighboring teeth around a missing spot to replace lost teeth. And now we have something called dental implants. A dental implant's a really highly specialized screw, and it has it's made of titanium. It has these special dimensions and surface textures that make it so you can insert it into the jawbone, and the bone and the titanium will connect in such a strong way, given enough time, that a tooth can be placed upon it, and that tooth can be used to chew, smile, talk. And the wonderful thing about it is you don't have to do anything to the neighboring teeth. You can just treat the spot where the tooth or teeth are missing. So dental implants is very much a part of the normal day in the life of an oral surgeon, oral maxillofacial surgeon, and periodontist. And you see here a little video. This is also, speaking of technology, I think one of you had submitted a question in your application about science, computer science, programming, technology, how to merge those things together. Here's a really great example. This device that you see here is called Yomi. This is it's the only FDA approved robotic assist device for dental implant surgery. You may have heard of robotic surgery in other parts of the body. and it does exist for various applications. Well, it now exists for the application of dental implants. So we can essentially plan in a virtual world in software on computers how to put an implant into someone's jaw, and then using this robot, we can transfer that plan exactly into their body in the position down to the 10th of degrees and 10ths of millimeters that we had planned it on the computer software. And that's something that's made possible by technology. So there is so much opportunity for technology, for innovative thinking, to push forward the frontiers of science and medicine. And speaking of questions, I want to throw out there right now, you might take a look at your dashboard there, and there's an option to submit questions. So please, as we're going along, feel free to jot any questions down and shoot them our way. And at the end, we'll try to spend some time answering your questions. Let's go to the next slide. Here's an example of doing some of that virtual planning that I was talking about. This woman was missing a few teeth. You can see the virtual insertion of a few implants there to replace those 3 teeth. And then using either surgical guides or that robot, we can put the implants in, let them heal, and the patient can receive teeth replacements on top of those implants. So it's an amazing thing. And I love being able to integrate technology and thinking into that. Let's go to the next slide. This is another virtual way that we plan things. So Dr. Bryan had mentioned reconstructive jaw surgery. That can be done for trauma, but it can also be done for just growth and development. Many people just have teeth that don't quite fit together properly, and braces and orthodontists can help make most of those people's jaws and teeth fit together correctly. Some people have actually a growth and development issue where even if you tried to move the teeth a little bit, the jaws still aren't really lined up to where the teeth could fit by moving them around. So we can actually reposition jaws surgically and make those jaws be properly aligned so that the teeth can then fit together, so that they can chew properly, so that they can have proper cosmetics, lip support, all the, the way that everything would want to look in your face, a chin line, jaw line, and all. In addition to that, we can have dramatic effects on patients' airways and breathing as well. So, and that's something that's done in a virtual world. We plan all that stuff on digital software, and then we transfer that using 3D printers and other technology to a real live patient in an operating room. Dr. Bryan's got a couple of words to share about this case.
As you can see here, when you look at these radiographs, you'll notice some things that are present that you wouldn't expect to be present. Mostly these little white things that you see kind of stuck to the face. We'll call it the skull. I guess that's really what it is. So this particular person has had a procedure done wherein we've taken the lower jaw and made some little bony cuts there, and we've actually repositioned the jaw in a more forward position. And we did the same thing to the upper jaw. Now, one of the cool things about being an oral and maxillofacial surgeon, and also, of course, other surgical specialties like orthopedic surgery is another example of what I'm talking about. You get to use what's called hardware, and who doesn't like a hardware store, right? These are little titanium plates and screws. You can't get them at Lowe's, though. You do have to get them from Specialized Surgical Supply Company. And these are very specialized, tiny pieces of titanium that you can actually bend with instruments and fashion them in such a way that they now hold the bones together after you've moved them into a new position. And the purpose of this is to get the person's teeth to be able to fit together correctly. As Dr. Goodson mentioned, sometimes the difference in how they are positioned is beyond the scope of what an orthodontist can accomplish alone. And so in combination with an orthodontist, we as oral surgeons work with the patient to get that bite correct. And you'll notice that in the third column, I guess you would say, over where you see the kind of pink tissue with the teeth and the braces, those teeth are not fitting together correctly. I think most of us can look at that and see there are gaps there. The front teeth, they're not really touching each other at all on the top and bottom. And then if you go that last one over, you'll see the teeth are now fitting together. So the things that we did in our surgical procedure in combination with the orthodontist allowed for that patient to have what we call a beautiful postoperative occlusion. That word occlusion means how the teeth fit together. So that is an example of a corrective jaw surgery, something that we really enjoy doing.
Okay, and so as far as a day in the life, just to continue for me, working as a periodontist, as I mentioned earlier, there's considerable overlap between periodontics and, which is again like gum and bone surgery, and oral surgery. We do not take out impacted wisdom teeth or do corrective jaw surgery as periodontists, but we do dental implants. And so anything that has to do with the dental implant, whether that's taking out a tooth, doing a bone graft, or placing the dental implant and temporizing the dental implant, all of that is something in the scope of periodontics along with gum surgery. And so my typical day in the life is I work Monday through Thursday. 8:30 is probably the start time, but roughly 8 to 5 as far as being in the office. And then again, like Dr. Bryan mentioned, surgeries at our office are in the mornings due to the fact that the patient is having to skip breakfast. And I concentrate again on gum surgery, dental implants. And then in the afternoon, we usually are spending that time having consults with new patients or follow-ups with our surgery patients, whether that's taking out their stitches or just looking to make sure everything's healing okay, figuring out if there's another step we need to move forward with their surgery, with another surgery. And then another thing we do as specialists is we work really closely with dentists in town. And so if you think about, you know, everybody kind of sees a dentist or should be seeing a dentist, but not everyone, you know, sees the specialist. And the dentists are really our avenue for getting patients. And so a really important part of our job is reaching out to the dentists in town, formulating relationships with them. And often that means giving them presentations about things we can do so that when they see something come into their office and they see someone maybe that needs a tooth to be replaced with something, they know exactly the technology and what we can do to help that patient. And in this slide, you can see a picture of me working with that robot that Dr. Bryan and Dr. Goodson were talking about. You can kind of see it in action here where the robot is draped to be sterile and using it on a patient. And you can see the little TV screen there in the upper left is the virtual plan being integrated. You know, we pre-plan it, we plan where we want the implant to be, and then the robot guides us to that exact spot. So it's been really, really cool, and it's fun because new technology is always coming out, and this is a job that we get to be at the forefront of that new technology. Really, really fun. And we can go ahead to the next slide. And that's just showing a picture of that implant there. And you can see, I included this just so you all could see that, you know, placing a dental implant has both scientific aspects, biology, anatomy, things of that nature, but also artistic. And again, looking at that gum tissue, you know, we want to keep the gum a certain shape so that the tooth or the tooth on top of the implant is healthy and they're able to keep it clean. So again, a combination of science and art. We can go to the next slide.
So looking back, Dr. Bryan, Dr. Fuller, and I will take just a moment and tell you a couple of things we wish we had known, talk a little bit about the rewards of being in this profession, and maybe just try to give you a few pearls, and then we'll hear from some of our other presenters. So just a couple of things I wish I had known. Academics are important. They are very important, as Dr. Bryan said, each class, each test, each bit of knowledge you obtain. And it's not just the knowledge you obtain, it's not just the test score and the grade, but it's the knowledge you obtain, and it's the ability to learn how to think, learn how to reason, and learn how to problem solve that is just paramount. So that's important. People skills are very important too, and you learn those as you go along in various settings. You learn them in school, you learn them in sporting activities, you learn them in social activities, service opportunities. Wherever you can engage with people, the more you can learn how to do that well and enjoy that, you'll be better off. There's this bit of talent versus hard work. I've heard it said different ways, but a lot of people will tell you that success is made up of a large part of hard work and a small part of talent. Some people will say 90% hard work, 10% talent. I think that the lesson from that is that you need to have some little bit of you that feels kind of naturally inclined in that direction. But even when you're extremely, extremely talented, it's still really only made possible by large amounts of hard work. So I would just encourage you to, set your dreams, set your goals, and work hard to achieve them. There's this bullet point on the other side: don't let doors close. Sometimes you'll feel like a door closes. Maybe a test doesn't turn out quite how you want, or a class doesn't turn out the grades quite how you want. But if that happens to you, press on, keep going forward. Don't ever allow yourself to feel that someone else is taking your dreams away from you, because it's all within your hands and within your power to just continue moving that forward. There's this idea of destiny. Am I bound to do this? Is it my destiny? And in my opinion, there's a lot of things that we could choose to do with our life, personally and professionally, and it's probably more down to our choices and what we choose to commit ourselves to than it is about a destiny, so to speak. So again, that element of choosing and hard work, I think, comes into play there. I would encourage you to cast a wide net. Like Dr. Bryan and Dr. Fuller had said, one of the things that you don't know is just that, the stuff you don't know. And until you kind of get along further and understand a little bit more what's out there, it's hard to really know what you might want to choose. So casting a wide net, means kind of considering a lot of options and leaving the door open to a lot of different directions. So I think that's something that's important to do. Job shadowing, anytime you can get a chance to visit with people who are in professions you're interested in, is just going to really give you a lot of information and experience to help you make good decisions. Let's go to our next slide. So the rewards of such a profession, you could list a lot of things on here. I decided to group it into tangible versus intangible. The tangible rewards are the things you can touch and see and feel. And, those are for example, in these corrective jaw surgery cases, that's when you reposition someone's jaw or you restore their smile or their teeth, and you can immediately see this person has been transformed, and it's just right before your eyes. That's both tangible and intangible. You can see it, touch it, feel it, but you can feel it inside on how good it makes you feel to have been a part of that. And then there's other intangibles as far as rewards, and I've kind of described this a little bit on our next slide. Let's go to the next slide. So some of the intangibles are going into a profession like this gives you opportunities to give back to people who are coming down your same pathway. So here we are finding ways to give back to the community. And then today, we're giving back to people coming down the road like you all. But, there's just, the sky's the limit. You could invent whatever you want to invent and give back in whatever way you want to give back. And this is some ways we've done it. Second chance, where we've taken someone who had no means, had no opportunity, but had everything seeming to work against them, despite working hard and pushing through every obstacle they could. And we're able to take a person like that who just had no hopes otherwise, and restore them to give them a second chance on their smile with the use of dental implants. There's some pictures of us doing a blood drive. One thing we've loved doing is Wisdom for Wisdom, where we find through an application process a student who is in need of wisdom teeth removal. And so we can help them by donating a wisdom tooth removal to them so they can have a little extra money for their own pursuits of wisdom in their education. Let's go to our next slide.
Okay, so just to quickly, briefly, Dr. Goodson touched on a lot of good points, and so I'd echo all of that. But one thing that I've noticed is that learning, like if learning is something that stresses you out when you're 18 or 20 years old, because you're just trying to make the perfect grade, and there's kind of this stress factor, and grades are definitely very important. But know that, you know, once you kind of get into your job and you are doing a job that's a passion, learning becomes so much fun. And so if you look at it as like, oh gosh, there's like 4 years of college and 4 years of professional school, and then a residency that could be 4 to 6 years or more, and a fellowship, oh my gosh, that's so much school, that just sounds horrible. But really, if it's something that you're passionate about, it can be really, really fun and interesting. And as you get through and further specialize, and as you get older, things just get more fun to learn about. So keep that in the back of your mind, that this is something that can be just really, really fun. Be enthusiastic as a student. Don't be afraid to approach, like Dr. Goodson mentioned, don't be afraid to approach your doctor or your dentist. Ask them questions. No one is ever going to not want to talk about their job. It would never bother someone if you were to email them or call them or talk to them in person and say, hey, like, I'm just curious, like, what is your job like? You know, no one's going to find that invasive or annoying. And I know it can sometimes seem intimidating to talk to someone about that, but I promise anybody is going to be like wanting to talk and share about their job. And so it's something that is an avenue that you all can use, the people you already know, to talk to about that. And I'm sure anyone would love to talk to you and answer your questions. Also know that there are ways to evolve how you're learning and studying if it's not currently working for you. And that's kind of goes along with that keeping doors open. Don't ever shut a door. If you get a bad grade on a test, go, you know, talk to the professor about it, and just kind of, you know, communication is huge. Don't ever think, oh, I'm not good enough, so I'm just not going to talk about it and I'm not going to ask about it. There's always backup options. There's always ways to keep pushing forward. I've made a couple bad grades in college, but made a wonderful score on my DAT because they were hard classes, you know. So just know that there's always going to be opportunities to learn and change what you're doing, and to never close a door. Go ahead to the next slide. And healthcare fields are an honest job. This is one of the biggest rewards, I think. You know, you're not picking a job where you're having to be savvy or sly or kind of like beat a system or cheat a system. In the healthcare field, you get to be this ethical, honest person every day. And every day, whatever your clinical honest judgment is what you get to do. So you never are sitting at your job thinking, gosh, I just feel like I'm getting pushed into something I'm uncomfortable with. And I think that is so huge, to have the ability to be this ethical decision maker and to truly take care of people. It means that even when you're tired at the end of the day, you truly feel like you're doing good and you're helping people. And that is huge, because I can't imagine the weight that it would be if you had some sort of job that was different than that or stressful. Also, like I mentioned earlier, treating fearful patients. It can be so rewarding to take someone who's so afraid and to then do a surgery, watch them come out of surgery and to heal from surgery, and to say, oh my gosh, it was so much better than I thought it was going to be, you know, to relieve their fears about it and to show them that getting a dental implant is something they can do and something that can make their lives better, just as an example. And a really big reward is just giving people these beautiful smiles and functional smiles by combining things that make me who I am, liking science and art. So just as a word of encouragement to kind of look within at what makes you happy, what you like, and what fulfills you, and finding a job that you can just do whatever that is every day. And again, it just comes down to kind of shadowing and finding things out. And balance, again, is everything. You don't want to study too hard and be so miserable that you're just always in the library and never, you know, with your family, but then you also don't want to be not studying enough. So you've got to balance things. It does take time to learn how to do it. It might be that you get a bad test grade and change something about what you're doing. But don't forget what's important in your life, those relationships with those people that are your friends and family and your support group. It's very important to have that and to spend time with that. So that would be a main pearl I would give you all.
Well, we're super excited to have our colleague, Dr. Phelps, back again with us. And so we'll just let him get right into it. He is the expert in all things neurosurgery.
All right, can you hear me now? Okay, fantastic. Well, thanks for having me. I'm glad to be back doing this. I think the third or fourth year we've done it, and it's been wonderful each time. So I'm excited to be here. In Oklahoma City. And a little bit about me. I grew up in Oklahoma City, just kind of north and west of the city in a little area called Surrey Hills. It used to be out in the country, but now it's about 2 miles into the city. I went to Yukon High School. My favorite subject there was math, actually. The choice I've had to be a neurosurgeon has been there for a long time. I've wanted to do neurosurgery since I was, goodness, like kindergartner. And I didn't know what neurosurgery was back there, but I knew I wanted to be a brain surgeon. So, you know, when people ask me why medicine, it's a very difficult question for me because I've had that desire and goal since I was little bitty, probably before I could even, you know, really form a thoughtful reasoning why that was. But fortunately, it's something that, you know, that I've really loved and that I've wanted to do, and that passion has never left me since I was, you know, a kindergartner, you know, 40 years ago. So I live here in Oklahoma, in Edmond. I work in Oklahoma City. I have a wife, 4 kids. Got some pictures of them up here, just of us doing different things. Next slide. I went to I did my schooling at the University of Oklahoma for undergraduate. I was zoology major, which was, you know, back when I was there, basically everybody who did zoology was pre-med. So that's what we did. I do have a minor in British Lit because that's one of my my favorite things to do is read. I went to medical school at the University of Oklahoma. And then after my medical school training, we do something called a residency, which is additional kind of on-the-job training in your various specialties. So mine was neurosurgery. I did that in Albuquerque, New Mexico at the University of New Mexico. While I was in my training, which lasted for 6 years after medical school, I did an MBA at Cameron University here from Oklahoma. So I thought that was a very important thing as medicine continued to move into and meld more with business, that I had some fundamental knowledge of business and things so that I could kind of talk the language on both sides of the equation. I thought that was very important. Next slide. So what do neurosurgeons do? We do quite a bit of different things. So basically a neurosurgeon treats disorders of the brain and nerves and some things that affect those, like blood vessel disease and things like that. So we do both surgical and non-surgical treatments, but our primary focus, of course, is surgery. So we treat things like traumatic brain injury that you might get in things such as athletic competitions, car wrecks, falls. We treat fractures, broken necks, broken backs. We treat things like tumors in the brain, in the spinal cord. We treat degenerative conditions of the spine, such as arthritis, which may be causing people to have problems with walking or feeling in their legs or significant pain. We also, there's also a significant overlap in what we do with a lot of stroke care. So we are quite involved in dealing with people who have had strokes, especially when they are caused by some type of malformation of the brain or the bleeding or things from the strokes are causing issues with people's functioning. We're often involved in the treatment of those things. Next slide. So one of the great things about medicine is, and I'm going to talk about this a little bit later as well, but one of the great things about medicine is that there's a lot of variability in it, and you can really tailor what you do for a large part based on what you like and things like that. So my typical work week is usually consists of a couple of days a week seeing clinic patients. So in an outpatient clinic setting, just like you might see your pediatrician or your family practice doctor. And then I do 3 days a week of actual surgeries in the operating room. I make patient rounds daily at the hospital, so everybody that's had surgery, we will see them, and any consults that come in from other physicians or at the hospital emergency room, we see those in the hospital daily as well. I do take a fair amount of call for the hospital that I work at, or the hospitals, plural, that I cover. And so again, we will see emergencies that come in or other issues that come in through the emergency rooms, things that develop there that we need to turn our attention to. Now, I'm not sure are these the videos that are working? Can we click on those? Does it work? Or are these just still shots? There we go. So I've put these pictures on. You know, one of the really neat things that we get to be involved with is we get to use a lot of great technology. One of the cool things about neurosurgery is that I kind of consider it the last frontier of medicine, so to speak. I mean, we can cut somebody's chest open and take their heart out, and then cut somebody else's chest open and stick their heart in it. But we can't do that with brains yet. So we're kind of at the forefront of a lot of amazing things that we can do and that we're learning to do for people. And these are some videos that I put on where we use computer guidance to take out brain tumors and to place screws. The first picture here is a patient who's having a brain tumor taken out. We've gotten some pictures. They're loaded up on that little screen behind them. And there's a little arm that's going above that screen that has actually a laser on it. And it looks at the little wand I'm holding in my hand, the little blue thing with the balls on it, and it can tell where that wand is in space. And if we could hit that first one again, you'll see me as I move all on that patient's head. If you look at the pictures right there, it allows me to trace out exactly where this tumor is, so I can make my incisions as precise as possible to take out things with the least amount of damage and the most safety for the patient. So that's really neat. On the right side of the screen here is where we're using similar technology to place screws for broken bones in somebody's back. And I've got a similar kind of wand there on the instrument, and we're actually seeing a virtual screw go into a bone right there as we place that in somebody's back. So these technologies are pretty amazing, and they allow us to be small and safe and very accurate, which is really fantastic for the patient. I'm sure that you guys have seen the Dr. Bryan, Dr. Goodson's robot, and how that technology can just do some amazing things for people. So it allows us to get smaller and smaller, but be better and better at what we do. So that's a pretty neat thing that I get to be involved with pretty much on a daily basis. Next slide. So, you know, going through growing up, kind of knowing I wanted to be a neurosurgeon, it's a kind of an odd thing, because when I talk to people about it, you know, I didn't have a lot of questions about what I wanted to do or what it meant. But there are some things that I kind of wish I knew about growing up. And I think some of these were discussed a little bit before, but there are a huge number of resources available. As a young person, you know, there's tons and tons of jobs that deal with science and health, from, you know, dentistry to, you know, pharmacist to physician to surgeon, and just within each specialty, these jobs can be tailored quite a bit. And there are huge numbers of resources as to what those are like. And one of the greatest resources was talked about just a few minutes ago, which are people that do the jobs. If you are interested in dentistry, talk to your dentist. They would love to talk to you, and they will give you the best, most accurate description of what it's like to become a dentist. It's going to be better coming from them than it will be reading it from a book or on the internet. Social skills are really important. And, I'm older, so I grew up in a very different era than many of you young people are, where a lot of the communication, for example, for my teenagers, they want to text everything. But that's fine, I guess, for certain things, but really you've got to be able to talk to people. You have to be able to communicate and pick up on cues of when you speak to them, understanding kind of things that they're saying to you verbally and non-verbally, and that's extremely important. So, I would really encourage any person thinking about medicine to work on social skills. And it's not like you have to take a class, just talk to people. Hang out with your friends, talk to, other people, your teachers, your, religious leaders, adults, other family members, just learn to speak to them, and develop the ability to carry on a conversation and to be able to pick up on the things that they're telling you, learn how to listen when you do this. Other things, kind of the last one here I put on this section is know the trade-offs. There's always trade-offs with everything that we do. If maybe you want to get a good grade on a math test, that may mean you need to skip playing video games that night and study. So there's always some trade-offs. And sometimes we trade things in the short term to get benefits in the long term. So any type of medical career, you're going to have to work, you're going to have to study. And that may seem a little difficult and disheartening, especially when your friends are kind of not studying and they're having fun and it seems like you're just working. But it's an amazing thing, to be able to reach your goals and then, have that ability to do the things that you want. And those trade-offs never stop, even when you are older. If you want to, make a lot of money, you can work extra time, but the trade-off is you're not spending that time with your family. And, vice versa. If you say, hey, I'm going to take 4 huge vacations a year with my family, you may not make as much money. And the trade-offs aren't necessarily good or bad, but they're there. And you just have to understand them and know where you feel comfortable with on that spectrum. All right, next slide. So there's a lot of rewards with what I do. And I think I've been very happy with the career that I've chosen and what I've done. I've loved every bit of it, even though there's some days it's not been the most fun. But there are rewards, and I think these will often basically cover many of the medical jobs, but I'm going to kind of talk mostly about neurosurgery here. One of the great things about being involved in healthcare is that there will always be work. There's a bigger and bigger population every year. People need to have, family practice doctors and dentists and oral surgeons and neurosurgeons and all kinds of things. So there's going to be the ability to work. The people still get sick in a pandemic. So when a lot of people lost their jobs in the pandemic, the doctors and everybody still had business. When the economy's great, everybody still needs healthcare. So it's there all the time. And it's a really nice thing. Gives you a little bit of security in your life. And another great thing is, there's always healthcare need pretty much wherever you go. So if you want to live in Florida or Oklahoma or a specific city near where you grew up, you can, and you can be involved with that job because people need healthcare everywhere. One of the great things about neurosurgery is that, from my standpoint, is there's a lot of cerebral aspects in problem solving. We have to listen to patients, look at things and diagnose issues and figure out ways to fix them. But at the same time, there's a lot of technical work too. So I get to use my brain and my hands, which is a lot of fun, kind of hit things from both directions. The nice thing about healthcare is because it is an in-demand job, you are probably going to get some good compensation. Maybe not NBA basketball player compensation, but you're going to live a comfortable life, and you're going to be able to take care of yourself and your family. And that's one of the most important things with this. Again, there's always a little bit of trade-offs, but for the most part, the compensation is going to be good, and it's going to be able to support you and your family. And the last thing that's really neat about medicine is something we talked about a little earlier, is you have a chance to tailor your job and figure out what you really love to do. So, just in my situation, neurosurgery, I love to do everything. So I basically like brain tumors, and I like spine work, and I do hospital call, and I do all kinds of stuff. I do trauma because I like that variety. Now, some people are not very interested in variety, and they like to do one very specific thing. Maybe it's they treat stroke, and they do that all day, every day. But the good thing is they get that chance. I have some partners who, they do not like to take calls, so they really don't, and they do a 9 to 3 job every day, and then they go home. But I would kind of get bored with doing little things like that, and I like some of the bigger, more involved things. So I don't get to go home sometimes at 3 o'clock, and sometimes I have to come in before 9. Kind of that trade-off that we talked about earlier, but you really get to have that opportunity to tailor what you like to do to your personal, needs and, desires. So that's a pretty neat thing. There's not a lot of other places that you can do that. You have a lot more relative autonomy as a healthcare provider. All right, I think that's my last slide. If I'm not mistaken. No, I've got another slide here. Sorry. So a few words of wisdom on these things. So right now, like I mentioned before, the difficulty for me is that I knew what I wanted to do from when I was 5, and I realized that's not most people. Maybe you do like medicine, but you don't know what's out there. So one of the things that I tell young people is cast a really wide net. Look at all these different things and things that you may not ever have thought of or even heard of, maybe something that once you learn about, you're very passionate about. So cast a wide net, talk to a lot of people, look at, a lot of things, what people do, and then pick what you love, because ultimately, it's better to do something that you really enjoy doing and work an extra hour a day than it is to do something you absolutely hate and work 1 hour less. So cast a wide net, find what you love, and really work on doing that. I've got this down here, talk the talk. And basically what I mean by that is you got to talk to people, and you need to talk to them about the things that you're interested in and what's important to each of these professions, especially as you get older. Just kind of ask them what it's like is not going to get it done. You're going to have to kind of do a little background work and really delve into the things and talk to the people and learn about what they do. Don't be afraid to try things. This is a kind of more of a life lesson that applies to medicine than a medicine lesson itself. But there's a lot of stuff out there in the world that is amazing, and if you don't try it, you may miss out on some really great things. I've had a lot of people that will say, "Hey, would you like to do this procedure while I supervise you?" And they're so afraid they don't want to do it, and they never get to see if they love it. So nobody's going to be perfect. Everybody knows that. Everybody on the panel and everybody who's worked in healthcare has made mistakes. We've done things that now we look at and we say, "Oh my goodness, what was I doing?" But you learn by doing so much better than you do just by reading or watching or studying. So don't be afraid to try, because as you try and you do things, you learn more, you get better. And then you have that ability to pass that on to other people. I think in medicine, if you're not humble to some degree, medicine will find a way to humble you. There are things that that we do that are very difficult. We deal with life and death situations, and sometimes despite our best efforts and what we think we know, patients don't do well. So it's important to always be humble. You know, you can be confident because that comes with experience and training and work. But at the same time, you know, realize that you're not perfect. And if you keep that humility, one of the things that you will, you know, that will drive you to do is work on becoming better and doing better for your patients. So you have to kind of walk that nice line there between confidence and humility to take care of people and do it right and do it well. And then the last one, you know, some people, they want to, you know, try to get around this one, but this is the thing to get basically anything you want in life. It's work, work, work. You know, some things are real easy for some people, some are difficult, but they can be overcome with hard work. And you get better, and with that, you get to where you need to be with that. So there's no secret, unfortunately, to that. But the nice thing is if you're able to do something you love, working hard is not bad. I mean, many days I look at my watch and, oh my gosh, it's 5 o'clock already, and the day's flown by. And it's just an important principle for anything that you do in life is to work. You want to have a good relationship with your family, you have to work at it. You want to have a good relationship, you know, with your coworkers, you work at it. You want to become a better physician or dentist or, you know, postal worker or banker, whatever you do, working is important. You want to be a good student, work. And I think one extra practical thing that I wanted to add on this year that, you know, a lot of kids will ask me, what can I do now in high school to get set up to be a doctor? You know, most of the time, as you move from high school to college to medical school or dental school and further on, not a lot of stuff carries over. Once you get into college, nobody cares what you did in high school anymore. Once you get into medical school, nobody cares what you did in college anymore. There are very few exceptions to that. So one of the things that I often tell people, especially when they're young, I tell them to develop things that carry over. So things that would always pique my interest when we had people interviewing with us were things like people that had done things, for example, where they've really put dedicated service or work into one thing, and that's carried over for years and years and years. So, for example, people that learned to play instruments and they'd kept that up. And, you know, it shows a consistent work ethic and dedication to things moving forward that they've done. And that would always tell me that if they're willing to work, say, to play the piano or some other instrument for years and years and years, I'm very confident if they come to work with me that they're going to put in consistent, dedicated effort. And that's something that's great that you can carry over. So if you play an instrument, if you volunteer to a specific thing, you know, I would rather see people that are kind of deep divers and that really get, you know, sink their teeth into something than kind of do like a little bit of everything going around. So those are the things that I would say. A few of the things that I'm involved with as far as giving back to things. I'm involved with the what we call the NREF, which is Neurosurgical Research and Education Foundation, and the CNS Foundation. And basically, these are organizations that help support education for trainees. The CNS Foundation is one that is really emphasizing medical equity throughout the world. So it does a lot to train neurosurgery providers throughout the world so that they can, you know, take care of underserved areas. And the NREF is one that is really dedicated to a variety of things, but one of my focuses and passions is socioeconomic things in it, neurosurgery, and the things that I get money to here help scholarships for young neurosurgeons to learn and become more facile with that so that they can, you know, help with our, you know, care that we give our patients. I think that's all I've got today. So I'm happy to take any questions here. Let me see here.
So I think what we'll do is, if there's any questions right now that are kind of neurosurgery specific, if you guys want to just throw those in your little dashboard, there's a little section where you can submit questions to the presenters. And then Dr. Phelps could take a minute.
I've got a couple here that I'll go over real quick because I'm sorry I've got to jump off and do another meeting here in just a second. But one of the questions was, I guess, as far as titanium implants, and one is the longest surgery I've ever been in. So for a lot of the implants that we do use titanium. We do use those for several reasons. One, they have very little reaction to the patient's bodies. We used to use some other metals that people had a lot of issues with. The other things about titanium is that it doesn't rust, it doesn't rot, and they don't set off metal detectors. You can get MRIs with them, which are all very important from our thing. Longest surgeries that I've been in, honestly, the longest surgery that I've been in was not a neurosurgery procedure. It was an ENT procedure where we did a huge dissection of, started with one side of a guy's neck and to the other, then he lost his jaw, then he lost his tongue because he did chewing tobacco. So don't do chewing tobacco, please, or smoke.
All right. Well, very good. Dr. Phelps, thank you. We know you're on a tight time schedule, so we'll let you hop off and we'll carry on. If there are other questions, Dr. Phelps, we can forward those to you. Thank you so much. And we can go to the next slide, please. Well, again, we're grateful to have Stephanie Chaplin with us again, guidance counselor, career counselor, a wealth of knowledge, and so I will let her take it from here.
Awesome. Can you guys hear me? Okay, great. So I'm Stephanie Chaplin. I have been in education for 10 years, and I am a career counselor. I've been a school counselor and an educational, my brain's moving too fast, educational consultant. Can we go to the next slide, please? A little bit about me. So I grew up in Atlanta, Georgia. I'm also in the military, so that's how I got to Oklahoma. I went to Lovejoy High School. Yes, that's a real name, in a real school. My favorite subjects were history and English. I love writing. I love the historical data, and it's always been said, those who do not learn from history, repeat it. Education has been my love for many years. I never thought I would be in education, but being a counselor has been really fun because I get to work with students, and I love it because I consider my students as the next generation of leaders. All of the students that are on the call, you guys are going to be the ones that are going to be building industries. You're going to be changing things. And to be a person that shares in the groundwork level of a student's life is just amazing to me. I live here in Oklahoma City, and I have one child who is in college, and she's also in the medical field, so I'm super excited for her. She's a junior at Langston University. Next slide, please. So I went to UCO for undergrad, and I went to OU for my master's. And one of the things that I've loved hearing today is about the educational knowledge and the rigor and endurance. A lot of times for my students, when you guys are getting ready to pick a college, which a lot of you are now, the biggest thing that you want to look at is what does the school offer? If you're interested in the medical program, you want to make sure that you're choosing a school for the opportunity, not just because you like the alma mater of the school. And I also went to OU for my master's degree, which I love OU, Boomer Sooners. Next slide, please. What I wish I knew. It's okay to be different. And I have to say this with a resounding voice for parents, for students, for humans. No one has it all figured out. A lot of my students that come and talk to me, whether they are in high school or they're college students, especially for my high achievers, majority of the students on this call are going to be my high achievers. And they also tend to be my perfectionists. And I want you to know you don't have to have it all figured out right now. It's great to have your plan. It's great to move in that direction. But a lot of the stress that I see in high school students and college students is I just don't know. Or I should know what I want to do. I'm getting ready to graduate. I should have a plan. Not always true. Sometimes you just may have an idea, and that's okay. And even adults don't have it all figured out. There are things we are still learning, including the pandemic. Great example. No one on the call has ever lived through a pandemic. So we are all figuring out life, and that's okay. And the great thing about the pandemic that I'm looking at across the world when it comes to careers is everybody had to pivot. There is no industry that the pandemic hit that did not have to pivot. And what I mean by that is that everybody had to tweak and change how they were doing business. So you have to be open to being able to change, to being adaptable, and as we've all learned, being incredibly flexible. Next slide, please. College prep workshop. So one of the things that I love talking to students about is swag. I feel that every student should be a swag student. What that means is students with achievable goals. You need to have some idea of what you want to do. You're either going to be college ready or career ready, which is fine. You want to make sure that if you are a senior, that you have done your FAFSA by this point. It's not too late, but you definitely still want to meet with your school counselors, and you want to get your FAFSA in place to make sure that you are ready to go when the fall hits for the 21-22 school year. And then I'm going to talk to you a little bit about essay writing and Oklahoma's Promise. Next slide, please. Investigate your career options. Basic things to know: application deadlines. Whether you are a freshman or you are a senior, that is the biggest difference between high school and the real world. When you see an application deadline, that's what the schools mean. So if they tell you that they want everything in by May 30th, they mean May 30th. Programs of study. As you are preparing to go to colleges, you're going to hear a POS. What POS means is programs of study. That's going to be the programs that help you figure out what you want to do when it comes to your majors in college. Another contributing factor is cost. If you can be a student without student debt, that is wonderful. You guys should definitely be applying to as many scholarships as possible. There is absolutely no cap on the amount of scholarships that a student can receive. And culture. It's very important if you have a chance to go and tour your university, because not every student is made for every environment. And what I mean by that is some students like a small campus, some students like a large campus, some students like for it to be rural, which means it's kind of out in the country. Some students like to be in the city. So you want to make sure that whenever you're going to choose your next university or college, that you go out and you make sure that that school is going to be a fit for you, because that's going to be your home for the next 4 or more years. So it needs to be somewhere that you love and that you can see yourself growing and adapting. Next slide, please. Testing information. Juniors normally take the pre-ACT, sophomores do the PSAT, and then junior year you do the ACT and the MSQST. You can take as many ACTs as you would like. It's always important. And when it comes to the college side, they're going to look at your highest ACT score. So if you took your first ACT and it was not exactly great, it's okay. And something that students need to know, especially being in Oklahoma, if you are on free or reduced lunch, you get 2 ACT and 2 SAT waivers available to you at no cost for your high school career. So that means that if you are on free or reduced lunch, see your counselors and you guys will get 2 ACT waivers and 2 SAT waivers. In addition to, Oklahoma has made it to where all 11th graders take the ACT as a graduation requirement. So by the time it's done, some students will have 3 free opportunities to take the ACT. You can take the ACT as early as the 8th grade. I definitely recommend starting your ACT in 10th grade. If you're waiting till your senior year, it's not necessarily too late, but you have to be in the testing environment to see where your weaknesses are, to be able to enhance your test scores. And the more times you test, the better you do. So for your sophomore and junior year, you're going to go in and you're going to do your ACT. If you are wanting to do the ACT this year, you have 2 more opportunities. That's going to be June the 12th and July the 17th. So if you are wanting to take 1 more ACT for the summer, again, those days will be June the 12th and July 17th. You just go on to ACT, and you'll be able to see where you can test near your school. The SAT dates are pretty much the same. If you are enrolled in an AP course, everyone will do their AP testing in May. So you want to make sure that when it comes to AP exams, a 3 and above are what colleges are looking for to be able to make your AP course count and give you the chance to opt out of classes at a university. So again, you want to score at least a 3. The highest is a 5 on your AP exam. When you have those scores, that's what then can transfer to your universities to be able to opt out of some of your basic classes. Okay, next slide, please. Scholarships and financial aid. We've talked a little bit about the FAFSA. The FAFSA is the system that guides or drives your application for financial aid and what you're able to get. You can go to, it's a really great scholarship site. I love this site because it breaks down scholarships not only by month, but also by interest. So if you are a student that's interested in the medical field, you could just look at only those types of scholarships. Or if you're someone that is kind of wanting to break it down even more and you want to keep it simple, this is April. You could actually go on to, you can go to and only look at scholarships that have an April deadline. So it's 2 ways that you can look at that. And again, there's no cap on scholarships. There are scholarships for everything. There's so much money that goes back every year. For example, if you're left-handed, there's a scholarship for that. I'm 4'11". There's a scholarship for people under 5 feet. If you have red hair, there's a scholarship for people who have red hair. And I'm telling you that because I want you to know that there's pretty much anything you can think of for a scholarship. And for my kids who are not the ones who like to write, there are websites that are for no essay writing scholarships. So there is something for you too. I love the Hispanic Scholarship Fund because we have a lot of diversity. So if you are a Hispanic student, please make sure that you check out the Hispanic Fund because there's unlimited funding that's going out and being geared towards diversity. Okay, College Start is another great website, and your Big Future College Board pairs with your SAT. So you want to make sure you're looking at those. Now, I have to plug the Career Tech Centers. Reason being is because while I was looking at some of the slides, the one thing that stood out to me for a technical center would be CAD. If you're going and you're learning a computer-aided drafting system, you may be the next student that designs something in a medical field because so many things are changing, and you can always have a trade and go to college. And a lot of people actually use their trades to help them pay for college. So just make sure you're taking advantage of every opportunity. Because what I hear students tell me is, well, Missy, I'm going to college. I don't need to go to a career tech. Well, the good thing about going to a career tech is not only is it free while you're in high school, it costs you nothing. Anybody can go. And you never know where those skills will take you, and trades travel. And that's a good thing about having a trade, whether it is anything from welding. I was even thinking about welding and how welding could play a role in some of the backdrops for technology. So technology is evolving, and as it's evolving and changing, the students that are on this call, you guys may be the ones that create an app that may do something with the medical field. You never know where it's going to take you. So always be willing to explore your options. Next slide, please. Oklahoma's Promise. We got some cool news for Oklahoma's Promise, which I'm so excited to share because we just got it yesterday. They are going to extend Oklahoma's Promise out to 11th graders. So what that means is that in the past, you had to apply for Oklahoma's Promise by the end of your 10th grade year, or you lost the benefit. The state has now approved that for next year, when you become an 11th grader, you can also apply for Oklahoma's Promise for 1 more year. So that is so great, because I understand in the pandemic, we've been out of school roughly 1.5 years. So if you didn't apply for Oklahoma's Promise in your 9th grade year because duh, you weren't thinking about it, and now it's your 10th grade year and you're still not thinking about it, you now have that opportunity. The one thing to remember with this particular thing is that for Oklahoma's Promise, it covers your tuition. So when you're talking to your counselors, make sure that you understand what that means. When you're going to college, you have your tuition, you have your books, and you have different out-of-pocket costs. So for Oklahoma's Promise in particular, it's just going to cover your tuition. And make sure, of course, you have a 2.5 and above, which I know everyone on this call does, because I kind of understand this group. And once you become a senior, you guys will be in a good place to go ahead and take this in addition to the rest of your college and scholarship funding. Next slide, please. Essays, do's, and don'ts. I'm going to keep it really brief and to the point. If you are applying for scholarships, you want to have a working scholarship and you want to have an essay that I would say is 1,000 words. I know you guys kind of freaked out about that. Let's talk about it really quick. Reason being, if you have a 1,000-word essay that's going to answer a broad question, like, for example, how have you overcome adversity? If you take that, take it to your English teachers, have them proofread it, get it into a good place. You can cut that down to as small as 250. Most of your essays are going to want you to have between 250 words up to 1,000 words. So if you already have an essay that you can tweak and change and make it to where it can go from 250 to 1,000, you're already in a good place. When you are writing an essay, I cannot say this enough because I sit on essay boards and I look at scholarships. Please do not bore the readers of your essay. You will not be memorable and it does not help. When we ask you a question to answer in the essay, answer the question. Don't go around the question. Don't miss the question. Some students will go into so many bunny holes that have nothing to do with the original question. So make sure that you understand what they're asking you and that you stay the course. Your English teachers are going to be your best advocate. Take your essays to them and show them your essay. Get as many eyes on your essays as you can, because when you're very close to writing something, you don't see it. And one of the cool things about the brain is that the brain actually plugs in the words that you miss. So when you're writing something, the reason you may not see it is because your brain has already thought it and has plugged it in, and your eyes actually don't catch it. It's a good eye-brain connection that I just love. So I have to talk to kids about writing their essays. And make sure that when you are preparing your essays and you're sending your essays, now everybody's kind of moving into the Google platform. So make sure that if you are using a Google Doc to send your essays, that it is going to be compatible with the systems that they are using for the scholarships and informations. Let's go to the essay don'ts. So the essay do nots. My first one is so important. Write too much ramble, thinking, and when you're writing something, it just doesn't flow. Make sure that you're staying on track. Make sure that you're staying to the point and tell a good story. That's the biggest part about a scholarship. So many students are afraid to bring themselves into their scholarships. And it's important that you are a part of it, because when you're sitting on the essay boards, which I do, we want to know, why should we give this student a scholarship? What's going to have the impact? What's going to change that student's life? So don't be afraid to share your stories, and don't be afraid to just truly write from your heart. And if you are not a good writer, again, work with your English teachers and get a good working essay. Okay? Next slide, please. Words of wisdom. Have fun becoming who you're destined to be and define success for yourself. So many times, especially with this generation, you have so much social media, and social media is seeming to make students feel inadequate. You're looking at everybody else's highlights, not realizing those are the highlights. You don't see what it took to make those pictures work. You don't know the backdrop to any of the images that you're seeing, but you're comparing your life to what you're seeing, and what you're seeing is not necessarily real or true. So you have to make sure that you're staying true to who you are. Have fun failing. We are perfectionists in this group. You are going to fail at something. And the good thing that I can tell you about failing is that that's really where you learn. When you are a high succeeding student and you've not ever failed at anything and you go to college and you make your first, heaven forbid, C, you're all over the place. Why? Because you're so used to succeeding and it just totally tears you down. And it's okay that you got that C. There are some classes in college and graduate school and beyond that you worked your tail off for that C. You really, really, really did. And that was truly the best that you could do. And that's okay. Don't beat yourself up about that. You would never succeed being anyone else. So embrace who you are. That's very big because I see so many students that want to be certain things for family, for friends, or for the facade. If it's in you to be amazing, go and be amazing, but be amazing based on what you define for yourself as being successful. Keep learning new things. We've all had to do that. To me, the only reason you should stop learning is because you're in the grave. Because every industry is evolving. When you love what you do and you have a career over a job, you're always wanting to stay with the cutting edge. For any practice, it's always evolving. What we learned 5 years ago may not be applicable now. What you learned possibly a year ago, pandemic is a perfect example, may not be applicable now. So you have to be willing to change and adapt and stay engaged in whatever's going to be your career choice. And the last thing is there will never be another you. So why would you ever want to be anybody else? You're going to succeed because you have the tools to be amazing and to bring what you have to bring to this world. You serve a purpose and you have a need to fill. And that's only going to be filled when you are truly being yourself. Next slide, please. And that's me. So if you guys have any questions, if you need an extra counselor, I realize that every school has counselors. But if you need another counselor to talk to, email me. I talk to students all the time. Students find me on Instagram. They find me on Facebook. They actually email me. You do not have to be a part of Putnam City. I was in Oklahoma City before I came to Putnam City. But I truly work with students all around the United States. And the reason I do this is because you guys are my heart and beat. I love students so much. And sometimes you just need an extra person to talk to because so many counselors have such a huge caseload that you may not can get the one-on-one that you need. So if you have questions or concerns and you need an extra counselor, there's my contact information. Feel free to reach out anytime. And that's me. Thank you.
Stephanie, that was incredible. I've actually gone through, and I am a doctor, as you know, and I took more notes on your section than anybody else's. That was really, really great. Thank you so much for everything. And by the way, I know that if you have questions for Stephanie, she will answer those because I've emailed her before and she got right back to me. So again, thank you so much for your just incredible presentation and your wealth of knowledge. We do have some questions that were posed prior to beginning today's meeting. So I'm going to read a few of those. If we don't get to your question, because we're running out of time, we will answer these. You can email us also. And also, by the way, it's a little different now with the virus and everything, but at some point, people will be very much welcome to come to our office and shadow us. So let's get started with a couple of questions. What college majors help a student best prepare for medical school? Can you major in something outside of biology? The answer to part B of that question is yes. Lots of my friends and colleagues have college degrees that were history or literature or music, for example. But there are those core classes that you have to take and that you have to have. In fact, I think a lot of colleges and medical schools and specialty programs are very much intrigued by people who have college degrees that are not biology or chemistry. Drs. Fuller and Goodson, did you have anything to add to that? Super. So really the key there is choose something that you love and have a passion for, do really, really well in that, make sure that you're also aware of the core classes that are required, because those are not optional. You have to take those courses. And so just work with your counselor on making sure that you're hitting all of those bullet points that are required. What will medical school be like for someone who wants to be a general, I believe, pediatrician? Also, is it possible to intern at a clinic? So I think leading up to your medical school training, a lot of people are sort of in the same boat. People who want to be an optometrist, a dentist, an ophthalmologist, a neurosurgeon, a oral surgeon, periodontist, even an orthodontist. All of those folks are kind of in the same boat, kind of all heading in the same direction. And then in medical school, you're going to be involved in a lot of didactic program work, book work, classroom work. And then at some point during your last 2 years, you're going to start doing clinicals. And again, a lot of those things are the same, but you will develop, I think this is really important, and I think it really pertains to this question. At some point, you need to start developing mentors, people that you look up to that are doing the thing that you want to do. And for example, if I were going to be a pediatrician and I would be in medical school, I would want to locate those pediatricians that are in the program where I'm located and really gravitate toward them, because they're going to give you advice that is really very, very pertinent to your specific goals and that you'd like to achieve. So I think having a mentor is very important. There are also certain rotations that may be optional that you could add on or that you could choose from. And so you want to make sure that you're looking ahead and planning, for example, if you want to be a pediatrician or whatever the case may be, that those rotations that may be optional, you have afforded yourself the opportunity to participate in those. But I think having a mentor is really, really one of the key things that you're going to want to do, regardless of the direction. And can you intern in a clinic? That would be part of your formal training. They do have those as part of most training programs. Also, as I mentioned earlier, getting a mentor will open doors for you to get into someone's clinic. We get phone calls very frequently regarding that sort of thing. How can I get involved in research during college and getting into medical school? Research opportunities are available at almost all undergraduate schools, and then also keep in mind, Dr. Phelps mentioned getting involved in things that carry over from one year to the next. That's the great thing about research. You may start a research project in your undergraduate training, let's say pertaining to some sort of thing, let's just pick cellular biology or something like that. That stuff can carry forward, particularly if you're involved in something that's resulted in writing a paper and being published. Those things build on each other. So talk to your guidance counselor. And by the way, you'll have counselors in college. You will have those available. And I recall when I was a college student, I met with my guidance counselor many, many times. It was very frequent that I would be in his office. And it typically is someone that is in your college degree program field of study. So for example, my guidance counselor in college was a biochemist. And so I would meet with him on a regular basis, and you're going to be able to find out what opportunities are available for research. And I would encourage you to do that, because it is a question that is asked very frequently during the interview process. And it looks really, really good. And again, it's not about the way things look. If this is your passion, is something that you're drawn to, you're gonna thrive in that and really do very well with it. And so I would encourage to do research.
Dr. Bryan, if I can make a quick comment about research, I think the subject matter that you choose to research is less important than doing the research itself. So you could research a variety of things. And what I've learned in having gone through these application processes myself, and also having interviewed many applicants for these positions of residency and so forth, the thing that is really important is the experience you had that, like I said when I was speaking earlier, the experience you had that teaches you how to reason, teaches you how to analyze data, teaches you how to investigate problems, solve them. And, you know, when you really dive into that, you learn that it can, there's just many factors to consider. And so research actually makes you a better, well, it enhances your skill at problem solving and critical thinking. And so what field you learn that in is not as relevant as that you learn the skill itself.
Perfect. We had a pretty specific question. I'm gonna answer it. How many years does it take to become a cardiovascular surgeon? Some people would say vascular surgeon, thoracic surgeon. So I'm going to answer this kind of in a bit of a specific way, but then I'll kind of get a little bit generic. Those folks and we all know people who have done this, Dr. Goodson and I, in our training. To become a thoracic surgeon, that is kind of a specialty surgical. That's a specialty program. So most of the thoracic surgeons would have gone to undergraduate school, medical school, just like we've described. Then they'll do what's called a general surgery residency program. A general surgery residency program is usually 4 or 5 years in length, probably 5. And that's where you learn how to become what they call a general surgeon. So a general surgeon would be the type of surgeon that you would go to have your gallbladder taken out, to have some sort of abdominal type procedure. They also do a variety of other things, but they're called general surgeons for that very reason. And so again, that's about a 5-year program. And then typically after that, you'll do a fellowship that is, and this is where it branches out into a variety of other areas, but a thoracic surgery, a fellowship, or a cardiovascular surgery fellowship would be done at that point, and that's usually 2 to 3 years in length. And so the same path would be taken by someone who, for example, would want to become a plastic surgeon. Dr. Phelps would have done something similar to this. So you'll do a general surgery residency and then do a fellowship type procedure after that. Looks like I'm getting a phone call here. Sorry about that. It went away. And so look into, when you're planning ahead, that's a very good thing to kind of keep in mind, is how long is it going to take me to do the certain thing? What looks good on a resume to get into college if we want to pursue our career in the medical field? A lot of those things the guidance counselor has already covered. I would recommend that you go back and look at your notes on that. But just in general, really good grades. And again, don't get disheartened by one that's not perfect every time. Good scores. So sorry about that phone call there. Good scores on your kind of standardized exams. Like we said earlier, research looks really great. Your essay is important. And then at some point during your application process, they also just want to know, is this someone that I think I can get along with and work with? And so that's where I keep getting this phone call. I'm so sorry. You have to be kind of affable of a person. And so I think your interview and that sort of thing is just as important as a lot of the stuff that you put on your application. Is that phone call coming through? Can you guys hear it keep coming through, or is it just on my end? I am so sorry. Someone keeps calling me, and I don't know how to make it quit. Something that I would like to, we've got a few more questions, and I think what we'll do is answer these on our website or via email. I'm going to answer it and tell them to stop calling me. Excuse me just a second. It's one of my son's friends. Carson, I'm on a call right now. If you could not call me back again. Thank you. It's just a Zoom meeting, That's how it works these days. One thing I would like to kind of say, that someone that that I was looking at their post recently that really struck me as really important in sort of being successful at whatever it is you're planning to do. And that is this idea of becoming comfortable being uncomfortable. It's great to know, like, what is step 1, what is step 2, step 3, 4, and all those different steps that you have to take to get to a certain goal that you have in mind. But you're not always going to know what all those steps are. And so it can be kind of uncomfortable taking a step in a direction where you're a little bit uncertain. And what you're going to find is when you take that next step, you are going to find the answer as to what the next step is. I'm going to mute myself, and I'm going to let Dr. Goodson kind of finish up because I keep getting this call.
Andrew, if you want to just read off maybe just a couple of the questions that we received as we're coming through here, we can field a few of those.
Yeah, I'll ask a few of them, and like Dr. Bryan said, we'll get to some of the others on our website. We'll put all the answers there probably sometime next week. But I know Dr. Phelps answered this from the neurosurgery perspective. It was actually asked while we were talking about dental implants, so I wanted to have you guys answer that as well. And there's kind of two questions. So how do titanium implants compare to the normal bone? Does it stay in there for the person's whole life? And then is titanium a good material because it reduces risk of infection?
So yeah, just to speak to the metal, the hardware, as Dr. Bryan referred to it, has gone through a lot of change over many decades of surgery in various parts of the body. Actually the advent of titanium dental implants came about again through research. There was studies being done in I think it was rabbits, where there was titanium screws being placed into bone, and for reasons completely unrelated to teeth. And at one point when they went back to remove these implants for some reason, again, unrelated to teeth, it was determined they were difficult to remove. So there was some thought that, okay, well, can this application of the titanium integrating into the bone be used for other things in the body? And so this titanium and bone concept is used all over the body. It's used for dental implants. It's used for hip replacements, knee replacements, joint replacements. So titanium and bone are just really compatible. They work really well. And like Dr. Phelps said, they don't set off MRIs. They're not magnetic. Don't set off metal detectors at the airport, that kind of thing. As far as the lifelong question, unfortunately, anytime you replace part of the natural body with some sort of man-made alternative, it isn't, you can never really say the words permanent or forever. Usually people that we know, and you may know these people as well, hip or knee replacements, they don't talk much about having them replaced, but every now and again, those people have to undergo secondary surgeries to revise those or redo those. And it's a similar thing in the dental implants. Most of the time, people keep those for a long time, but not forever, because they are susceptible to disease or other problems. So, but by and large, they're very long-term solutions. What else you got there, Andrew?
And again, I know Dr. Phelps answered this one, but I think it applies to everyone. What is the longest surgery you've done?
Yeah, that's an interesting question. In the clinic, we do normal everyday stuff: wisdom teeth, dental implants, gum surgery. But those are on the shorter end. Those are probably in the 1 to 2 hour range. And then if you had a surgery that was really involving and complicated, like some of the trauma surgeries or cancer surgeries like Dr. Phelps was talking about, those can get very long, and they often involve multiple disciplines. So some of my longest ones were back in my training in residency, where there was an oral and maxillofacial component, there was an ENT or ear, nose, and throat component, and there was a neurosurgery component. And each surgeon would come in and take their turn of 3, 4, 5, 6 hours on whatever they were working on. So the patient probably experienced a total surgical time of somewhere around the 20-hour range, but none of us was personally in there for that long. So in the hospital, you know, for me, it's probably been in the 6 to 8 hour range. And it's funny, when I was growing up, I thought, how could someone ever do something like that for so long? But again, just like we talked about, sort of desensitizing yourself to the sight of a little bit of blood, you just figure out a way to kind of get in the groove, and you feel like it becomes a very normal thing for you. So even though it sounds bizarre or kind of like crazy, it like I said, it becomes normal. What else we have, Andrew?
I was going to add to that. The question probably pertains to like, gosh, does that sound like, you know, a job I'd want to have if I was like in a super long surgery all the time or something? But like Dr. Goodson said, you know, when you're in training and you're learning, you're moving slower and things are going to be longer. And when you get into your job and you start honing your skills and working up your speed, things go faster. But I would also echo what Dr. Goodson said about, you know, when you are in high school and each of your classes is like an hour long or less, you think of like multiple hour surgery is, oh my gosh, could I like get through that? That sounds like so intense. And it is true that, you know, but if you think about doing something that you like maybe you really like video games, you could probably sit there and play video games for 10 straight hours. And surgery kind of becomes like a video game, you know, in essence, or something similar where you really do zone in. And it's something that, even though it's multiple hours or a long portion of your morning or your day, it can be really, really fun. So don't let the time thing kind of deter you. And again, it is very variable on how long certain surgeries take.
Okay. I'm going to go into our final 3 questions, and then we'll get to those scholarship and giveaway portion of the event. And I'm going to add a little bit to this question since we've talked about job shadowing as well. So are internships and maybe job shadowing important or an option? And then when's a good time to start both of those?
So the quick answer to the question is yes. And just a couple details. Shadowing is very easy and quick to set up. It's as simple as a phone call or an email to an office. And there's lots of people who would just be willing to have a shadow or stop by the office for a day or two. So that's very easy. And shadowing can be done on kind of a micro scale. You don't have to, you know, whereas an internship may be a much broader commitment for a long term or a semester or a few months or a year. So you can get a diverse experience with many shadowings. And then in contrast, that an internship can give you a little more in-depth experience in one specific area. As far as internship opportunities, those would be more facility specific. So you would just need to take that specific question and talk to hospitals, talk to clinics, surgery centers, and you'll probably find less opportunities for that than shadowing, but there definitely are opportunities for it. I would encourage you to look around.
And I'll just add to that as, you know, the role of mom or counselor or whatever, when you are job shadowing or doing an internship, obviously dress professionally and maybe not what you'd wear every day to school. What is one thing that you've tried and failed at that helped you become a better surgeon?
Okay. That's a good question. I like that question. One of the things that you will find when you become a surgeon or really any other type of physician or healthcare provider, you are a lifelong learner. And it quite literally, in fact, it's actually required that we do continuing education. So we are frequently learning new techniques. And we'll go to a CE course and we will take a program from what would be considered an expert who will present a new technique to us. Well, not all new techniques work. New techniques sometimes can be on the forefront of thinking, and you might try a procedure of some sort and you don't get the outcome that you desire or that you thought you would get. And that doesn't feel very good always. But the key there is something about the procedure that you did or something about this technique that you did, you will have learned something from that. And then you will take that bit of knowledge and you'll add it to the things that you do that you know that work well, and you become better for it. And so I think from our perspective, most of the things that we fail at are specifically pertaining to procedural type things. And then, of course, you know, there are also life journeys that you fail on. And Dr. Goodson and I talk about this very frequently, that we're both fathers, and we ask ourselves the question, am I being the best dad that I can be? Is my career interfering with that? Is this meeting that I'm having here in a couple of weeks, is that going to interfere with something that my kids are doing? And it's important that you look at those things and ask yourselves the hard questions. Those people that I have in my life that are important to me, am I continuing to keep up sort of my end of the bargain on those relationships and those sort of things? And you'll learn from that as well. So I think that's an important thing to keep in mind.
Okay. And the final question is for Dr. Fuller. What is it like being a woman in the healthcare field?
That's a good question. It's something that I think is really, really fun. I think that, you know, whether you're a woman or you're, you know, just different in some other way from kind of the typical dentist or healthcare professional, it gives you kind of this opportunity to, you know, engage with your patients in a way that, you know, you kind of have these differences that allow you to kind of share that with your patients, and it can be really, really rewarding. That said, there are some things that can be difficult about it too. You know, when you're going through school and your classmates or your co-residents are all male and you're the only woman, like, you know, you do kind of feel like you're singled out a bit at times. But, you know, it is a changing world. There's more diversity all the time. There's more women, there's more people of all different backgrounds coming into medicine and dentistry. And so if you're, you know, someone like that and you kind of see, like, say you're someone in high school and you're thinking of becoming a doctor, find like a woman doctor that's in an area that you could see yourself being in, that you share personality traits with, and kind of talk to them about, you know, what their experience was like, because everyone's going to have differences. But I think that those differences can make you a really strong candidate for, you know, going into different programs, and can make you a really strong doctor or dentist or surgeon. And embracing those differences can be really good. I mean, just as any of you may have already experienced, you may come up against some different challenges than some, like a male would, or someone else that's, you know, kind of been prevalent in the field for a long time. But if you kind of take those experiences and think, well, how can I make the best of the situation, and how can I change people's minds, and how can I open their minds to who I am and share my gifts, it really can be really, really rewarding.
Thank you. Dr. Goodson, take this slide, or do you want me to?
Yeah, thank you. We'll kind of conclude here, guys. Thank you, everyone, for joining. We are going to share some two last things here. We have, of course, some awards and scholarships we're going to announce in about 30 seconds here. But I mentioned when I was talking earlier about Wisdom for Wisdom, this is something we get excited about, to be able to give back. So if you know anybody, or if you personally are in this boat where you need your wisdom teeth out, and there's, you know, educational expenses coming down your way, that's a way for us. We've found that we can give back a little bit to education. We can find someone who has need and desire for learning. We can donate our services, and then in turn you can have a little bit of extra resources that you can devote towards your education. So we call it Wisdom for Wisdom. You know, look into it, share it around, and we hope to find someone who's you know, who needs that and wants that, and look forward to giving that away. So Dr. Bryan, we'll let you kind of conclude things, and we look forward to hearing about who our scholarship and award recipients are this year.
Absolutely. And I just thought how wonderful it would have been if Dr. Goodson had his trumpet and could play the Jeopardy theme song while I'm reading these names off. I mean, be very compelling. Or maybe a drum roll. So anyway, thank you again, everyone. We do have a couple scholarships here. So we have two $250 scholarships. And those, all of these were chosen by way of evaluating essays that were submitted to the practice. The first winner is Aubrey Atkins. So Aubrey, you'll be receiving a $250 scholarship. The second recipient is Ashton Nickerson, who wrote an incredible essay that everyone just kind of fell in love with. So congratulations to Aubrey Atkins and Ashton Nickerson. And thank you again for submitting essays and being a part of our program. We're super proud to have all of you here. We also are giving away an iPad, and that will go to Matthew Maddox. So congratulations to Matthew Maddox for winning the iPad. An Amazon tablet will go to Helen Park. So Helen, congratulations on receiving the Amazon tablet. And you know, some of those things are kind of academic type things, but we also thought let's throw in something kind of fun. So a gift certificate to the main event will go to Emma Hawkins. So congratulations, Emma, on winning the gift certificate to main event. Super fun place. I'm sure you'll have a great time with your friends there. So thank you again for joining us. We love this program. It means a lot to us. Please take advantage of our availability. We're happy to talk to people on the phone. We're happy to field questions via email. When things get back to more normal situation, we would love to have people in our office. And my hope is that next year, when we do this, we'll be having it in person. That's what we really, really love, because we love to engage with you guys personally. It also gives us an opportunity to just kind of, sometimes people are hesitant to ask questions, but we do find that the in-person meeting fosters that environment sometimes a little better. And we will look forward to making that announcement at some point when that will occur and where that will occur. So until then, questions, please take advantage of all the panelists' emails and ask whatever question and get involved. And remember, be comfortable being uncomfortable, and don't worry about every single step along the way, because the right next step is going to come to you in some sort of way. So until next year, you guys take care, and we will see you then. Thanks for joining.
Yeah, thanks, guys.
Thank you.